Hey friend, welcome to The Thankful Nurse. I'm Rebecca Bongers, a wife, mom, and nurse who gets it. Let's talk about the real stuff: burnout, long shifts, tough patients, and also the moments that make it all worth it. Together, we'll explore how to stay strong, stay kind, and stay thankful, even on the hardest days. Hi, and welcome back. I'm so happy to have you joining me today as we discuss today's topic, which I feel is very important to me and I'm passionate about because it's something that I deal with continuously. And that is nursing is tough. Nursing is not easy. No news to you though, right? But hear me out. I want to talk about how when our kids do something hard, when they're learning fractions, for example, and they're frustrated and it's challenging and we're going through, if we're homeschooling, we're going through it with them, or if they're in school, they come home and we're trying to help them with their homework and help them make sense of everything. And it's overwhelming to them. It's frustrating. It's difficult. And we don't tell them, come on, you should know this, or it's no big deal, because we know what it was like when we learned how to go through fractions or English or whatever our difficulty was in school. Maybe it was the whole thing. And so we don't belittle them or treat them like they're stupid because they're learning, because what they're doing is difficult. There are concepts that they have to learn and understand, and that takes time, and people learn differently. And so I just want to point out that when our kids are learning something difficult in school, that we encourage them, that we acknowledge what they're facing is difficult and it's a challenge for them, but that they'll get it. Same with tying shoestrings, or nowadays I'm one of those parents that opts for the shoes that have the stretchy shoestrings that you can just slide on. But learning how to tie a shoe is important. And to us, it's second nature. We can do it with our eyes closed. But for kiddos, when they're first learning, it's challenging, it's difficult. And when we treat them like they're stupid, they don't do well. Most of us, we don't respond well to being belittled or being treated like we can't do something or that what we're doing isn't hard. And so I just want to make that point to say, I want you to treat yourself with that same compassion that you give to your children or that you give to those in your life that in different situations, because what we do is not easy. And there are many things that are hard and we get better at them, just like tying shoes, and they become second nature. But there are a lot of things that remain difficult. And I think that finding the relief and the break and the self-care, all of those things are a challenge, and we have to actively learn and actively do what we can to make our lives better and to make us be well so that we can be well as we help to heal people. So I want to talk about the fact that nursing requires physical demands, it requires constant mental load and mental demands, and also emotional. And so I just want to lightly touch on each of these. So as far as physical demands, I'll share an example with you. When I was orienting in the ICU for a while, we had a critical patient that was hooked up to everything, right? They were intubated, they had multiple drips, they had the feeding tubes, they had IV fluids, antibiotics, all the things going on. And my preceptor was helping me to take in all of this information. And she was amazing. Shout out to my preceptor in the ICU. And so I remember thinking, like, we had to take this patient down to CT scan and then bring them back. And just the physical load, the physical demand to do this one test, take this patient to CT scan for imaging and bring them back, what that required physically to navigate the pumps, take the modules from the poles and put them onto the bed and keep the line straight, call respiratory therapy to go with us with the ventilator that can go with them, putting the SCDs to the side because we don't need them for that little bit of time, making sure their Foley's where it needs to be, emptying it before we go, all the little details that we take for granted that it requires to do something like this. And I remember when we took them down, did the CT, brought them back, and we were getting everything reconnected. One of the IV lines was crossed or something. And I remember my preceptor like actually crawling behind the bed before we got everything locked in and just to get things situated, and thinking like, wow, that really is physically demanding. That was a big impression in what we were doing. Another example is proning patients, like during 2020 when we were proning everybody, and like what it physically took to do that was insane, And so I want to acknowledge that what we do is physically exhausting. Now I work in the emergency room. We definitely get our steps in for the day. Some shifts you can have like 20,000 steps. And that's just getting patients, moving them where they need to go, grabbing supplies, different things that you need, taking them to imaging, whatever you're doing. It takes a lot of stamina to get through a 12-hour shift. And so physically, nursing can be very exhausting and very challenging. Let's go over the mental load. So I feel like whatever area of nursing you work in, this particularly stands out to me from my med-surg experience, but also relates to ICU and ER, that you constantly have a to-do list in the back of your head, running in your mind simultaneously while you're doing all these other tasks and skills. And the mental load that requires, and the focus and the diligence to not miss important things or not forget about certain things, like, let's not underestimate what that takes. That takes a lot. I would consider that to be a superpower, because it takes a lot to have that constant to-do list in the back of your head and knowing, okay, I just got a patient into one of my rooms and they came from the ambulance, so I've got to do their report, get report from EMS, do their triage, get them on the monitor, get their vitals, get their history, get their IV and their labs and the fluids and whatever they need when they first come in. Simultaneously, that in the next room, you have a patient who's withdrawing from alcohol, and that you gave them phenobarbital, a load, and it's time to recheck their CEWA, and you need to see if their fluids are done. That you're still pending a urine, or, you have that constant list in the back of your head of things that need to be done and need to be completed, all the while trying to be in the moment and pay attention to what you're doing and do a good job. So mental, that is a huge load and a huge burden. And let's just use med-surg for an example. So you have this patient, they're pretty stable, but they're total care. So once you get them all situated, turned, and repositioned, you have to feed them. And if you have somebody that's able to help feed them, kudos to family who comes and helps with feeding, or if you have other staff that can help. Otherwise, you as a nurse, like, that's part of your role too, is making sure your patient eats and gets that nutrition that they need while they're admitted. And then you go into the very next room and you have a patient who's post-op, and you're monitoring their vitals closely, monitoring their wound site to make sure they're not bleeding, doing all of those things, checking for their nausea, and then you're also monitoring their pain. And then you go into the next room and you have a patient that, wow, there's early signs of sepsis and the vitals are wonky, and that needs to be addressed. So I feel like that's also a mental load, trying to keep track of everything that's going on. Truly, you can only be in one place at one time, but you're trying to prioritize. I think prioritizing just requires constant mental load. And so it's no wonder at the end of a 12-hour shift that you have mental fatigue, and so we'll go over more self-care and stuff in a different episode, but it's a no-brainer that you need hydration, that you need fuel for your own brain, that you need rest periods. Like, what you're doing is demanding. And then as far as the emotional side, you take care of people that are end of life, and you take care of people that just received horrible news. Like, I don't know, just a few weeks ago, I had a patient that was having blurry vision and vision changes, and presented to the ER to find out what was going on, and come to find out this patient had a brain tumor, and they had already had a previous cancer, gone through the treatment, had been in remission, and then this new thing comes up. And I don't care who you are, that impacts you emotionally, because as a human, you think of yourself also like, wow, to get that kind of news. If I got that kind of news today, like, wow, or my loved one had some kind of news also. So you have that emotional aspect, but you've still got to function in your role. You've still got to go to the next room and it's a psych patient and you're trying to get a good rapport with them and build trust and be patient and therapeutic. And then you go to the next room and you have a super chill patient and the family's joking with you. And, it's just emotionally, it's like a roller coaster what you're going through. Another side of the emotional thing is when you do have patients who are challenging, whose behaviors, sometimes are triggering, and they come to the ER for help, and we're there to help, and that's what we do, and we want to help and we advocate for our patients. But sometimes they are rude and they're mean and they don't treat us very well. And it's that emotional side of, do no harm. Like you're trying to do your ethical duty, but at the same time, like it's difficult to go into that room. So there's that's, I guess in this podcast, we talk about things that are real. And I remember having a patient not too long ago. And after, being in that room for almost an hour and coming out and saying, I am leaving healthcare because the emotional load that it took to care for that person, was very demanding. I guess I say all of this to say that what you do matters, and it makes 100% sense that you need to be cared for, that you need to fuel your brain, that you need to relax, that you need to do what it takes to be well yourself, because what you're doing, it's like people that train in the Olympics or that train for a half marathon, a new runner, like you have a plan that you have to follow, and that includes rest days, and that includes proper nutrition, and that includes proper sleep. And it's no different with this career. Also, I just want you to acknowledge that what you do is important and that you need to rest and that you need to care for yourself. And another side note to that I want to add is we need to think about this when it comes to new nurses also, or new healthcare professionals that are entering the field. And when they talk about being exhausted or drained or all the things, that we treat them with compassion and understanding, and that we encourage them to take care of themselves also, rather than being like, oh, well, welcome to the job, or treat them like, belittle them, instead of saying, no, actually, this is really challenging. And on your days off, make sure you do something that recharges you, that refuels you, that's good for you. That's just a little plug-in for new nurses and people just in general, like treating people with kindness and understanding. It goes back to, we don't know what people are going through. And so many times people have their own emotional challenges at home in their personal life that are going on. And then you still have to come to work and do this role that we just talked about, how demanding it is physically, emotionally, and all the things. And so just to have compassion for yourself and to have compassion for other people, because sometimes we're going through this in a time of grief. Sometimes we're going through this in a time of, we have our own loved ones that are sick, or people are going through a bad time in their relationship, or whatever the case may be, financial struggles. Like, just be mindful, just come back to square one, that like we are people and that we need to treat each other with kindness, and we need to treat ourselves with kindness. I guess that's my little soapbox. Another aspect with the physical demands in the ER is that we never close. We're always open. It doesn't matter that every bed is full and every chair is full and the waiting room continues to stack up and EMS continues to bring patients. We can't say, oh, sorry, we are not going to see any more people. Like, it just keeps coming and we just keep rolling with it. And there's no way to know, from working in med-surg and my little time in the ICU, like, you kind of have time to prepare. You kind of know what you're getting. You can kind of get some sort of history, and things are kind of set up for you. Not saying that it's just all done. No, it continues, continuity of care. But in the ER, like, people come to you and you have no idea. You're starting at square one most of the time. And so just that constant thing of, you don't know what's going to come in. It could be a motor vehicle accident. It could be a burn. It could be trauma. It could be sepsis. It could be, the list goes on, right? And so just the fact that you do have that constant pressure, don't underestimate that. Like, it's better to acknowledge it And that's why I'm doing this episode, is because I want you to acknowledge that nursing is hard. Nursing is tough. It is challenging, because when you acknowledge it, then you know, hey, it's hard and it's tough, but so am I. Like, I am resilient. I can do this. I can overcome this. I am stronger than the storm, so to speak. And so I think being acknowledged, sometimes it's like with your family member or whoever you have in your life that you can vent to, and they don't necessarily fix everything, but they just acknowledge what you're going through. Just having that validation, it like gives you what you need to go on in a way. And so I just want to do that for you today, is acknowledge what you're going through, acknowledge the difficulty that you face, and also encourage you that you can get through this. And so I would like to share a couple of tips of things that have helped me. And I don't know, it may seem kind of cheesy or whatever, but if it helps you, then that makes my day better, because I want to share things that have made my nursing career better and helped me get through many of the difficult days. So the first one is, I love music, and I think music is a powerful tool that we can use to our benefit and we can use to our advantage. And so I would say one thing that helped me a lot is I found a song that was like upbeat. It's called Never Giving Up on You by Matthew Parker. And I would listen to that song, especially on my way home after a shift, when I was reflecting on how the day went and the struggle that it was. And I would sing that song, and it says, I'm never giving up on you. And I would look in the rearview mirror occasionally and like look at myself, and I would tell myself, I'm never giving up on you. And that was important, because we need somebody to care about us, and we need to care. We can be that person that cares about ourselves. And I have a great support system, and I don't take it for granted. I know what a blessing it is to me, but it's also important to do what we can for ourselves too. And so I'm getting emotional, because that really was something that helped me, listening to that song. And when I hear that song to this day, it encourages me, and I still tell myself, like, I'm never giving up on you. Like, yeah, it's hard. Yeah, things aren't perfect. Yeah, you struggled today, but I'm not giving up on you. So much of what I go through in my life, like what keeps me grounded is my faith and my trust in God. And that's where I get so much that keeps me going. So finding a song that kind of reignites that in you and helps you realize, like, hey, it's going to be all right. You know, another song, my current song right now is Up by Torrin Wells. And the chorus is like, you've been having a hard day, but you ain't never given up, 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 up. And it's just such a fun, uplifting song. And I had a really hard day this past week that was very busy, very physically exhausting. And I hardly was able to hydrate during the shift. And on my way home, I played that song loudly. And I just said, you ain't never given up. And I guess I want to share with you, in case maybe you already have a playlist that you listen to, but if you don't, just take like 5 minutes today and find a song that speaks to you in a positive way, because there's a lot of songs that can get us in a different kind of mood, but I think it's important to find one that puts us in a good, positive mindset. And so those are two that I wanted to share. Another thing is find little things that bring you joy. And I'm going to take a little detour and say that this isn't just in your nursing life, but in your regular life, because you are more than just a nurse. There's so much more to you than just your career. And so I want to share, sometimes as a mom, like I feel like I'm not doing enough, or that I'm not fun enough. Like one of my greatest desires is to be a fun mom. Like I just want to enjoy my kids, and I want them to know that they bring so much joy to my life. And so sometimes we don't always convey that. And so I want to share this story of something that happened a couple weeks ago. So I was cleaning under the couch, and I found there was like a lot of junk under the couch. And I found this, it was like a bubble party favor from a wedding. And we got that out from under there, and I finished cleaning. And then I went into the bedroom, and I just like called both of my kids in there, and I put on some music that was upbeat, and I literally just blew bubbles with them for like 5 minutes, and we just had a great time. And so I just want to acknowledge that sometimes it doesn't have to be we did an hour of arts and crafts, or I played with them at the park for 45 minutes, or whatever the case may be. Sometimes we can't really muster up what it takes to package them up and take them to the pool and do all the things. So I just want to acknowledge that it's okay to just find a little bit of time to do something fun. We sang, we danced, we laughed, we connected. I was blowing bubbles, and I'm thinking this is preventing atelectasis in my own lungs. This is helping with my breathing for singing. And I don't know. When I did that, I just thought I wanted to share that story on this podcast to show that it's the little things sometimes, you can't always do just this big grand thing in our life. Like, I'm burnt out, I'm stressed, I want to go on this amazing vacation. Of course, we want to do that, but that's not always reality or practical. And so sometimes just finding something that really makes your life better and savoring that. Another tip is that thinking about something that went well during the shift, because our mind can focus on our exhaustion and our stress and how rude that patient was and how hard it was to do this certain thing. Our mind can focus on those things. And yes, that's part of the day. That's part of what happened. But I think intentionally thinking about something that went well, like, wow, and this sounds so cheesy. And when I've heard people say this, it kind of sounds cheesy to me, but it really does work. Like, that patient said thank you, or that patient said, I didn't even feel when you put in my IV. Like, just something like that. Hey, that went really well. Like, I got most of my IVs today. Or just focusing on one small thing that went well, that made the day better, and acknowledging that there was something good. Even if it's just that I survived the shift and I made money to support my family. I mean, that's true, and that's positive, and that's a good thing. And focusing on those things, I think, helps in general. I love listening to podcasts myself, and one of my podcasts that I listen to is actually house cleaning, and the person is called Clutterbug. Shout out to Clutterbug. So whenever I'm cleaning at home, I literally listen to her podcast because it just helps me to clean. It helps me to get things done, helps me to declutter. That's a little joy that I have in my life, and that helps me with the hard stuff like cleaning the bathrooms and things. But I listen to a bunch of different podcasts, and I think from a couple of these, or a combination of them, I learned like speaking positively to yourself out loud helps. And so I have used this, and I feel silly almost every time I do it, but it actually does make a difference. Is when I'm having a hard day, or I feel that stress and tension building up in my body, I tell myself, you're okay. I actually tell myself, you're okay, baby girl. I call myself baby girl because it adds that element of like self-compassion to tell myself, you are okay. And so I'll go in the supply room and I'm grabbing whatever, and I literally say, you're okay, baby girl. Like, you got this. It's going to be okay. Or you've done this before, or you're not alone. You have help. You can do this. And I'm a firm believer that I've come to the place where I trust God with whatever comes my way. And I'm like, God, I know if this is coming to me, that you are going to get me through it. And so I tell myself that, like, God's got you. God will take care of you. You got to do your part. You're going to be okay. And so I feel silly talking to myself because I believe in prayer, and I pray. That's another thing. I pray all the time, and I'm constantly asking God for his help. And it just feels silly talking to myself and saying, you got this, baby girl. Or at my previous job, most of the staff would call me, my last name is Bongers, but they would say Bongs. So a lot of people called me Bongs. And so to this day, I'll tell myself, it's okay, Bongs, you can do this. Just try it, just hear me out. Just try it and see if it works for you. I remember one of the earlier times when I was in the ER and I had a really critical patient, and I got the assignment in the morning, and that patient had come in early in the morning. I was very sick, and before I went into his room, I went and I grabbed a warm blanket to take in, and I remember like dry heaving, like gagging, because I was so scared and so nauseous. I felt like my fight or flight was just through the roof, and just remembering like, you're okay. You can do this. You've done this before. You have help. you have support. Sometimes we know these things, but we don't always feel them or we don't always remember them, and our emotions can get the best of us. And so that's just another little tip or word of encouragement that I have is just try it the next time that you feel overwhelmed or frustrated or in over your head. Just say, you know what, you're okay. You've got this. And so I also want to tell you, in case no one has told you today, that you've got this, that you can do this, that you're going to be okay, that you're doing a good job. And to end this podcast on a cheesy note, I want to say that nursing is tough, but my friend, so are you. If you like to read, please consider checking out my book I wrote, Living Trust. It's a short story about a nurse and her husband who learn about trusting God in the midst of their difficulties. It's an emotional book filled with grief, adventure, romance, and ultimately learning to trust God. If that sounds interesting to you, please get your copy on Amazon today. Thank you for tuning into this podcast. And please remember, this podcast is for entertainment purposes only and not intended to substitute for medical advice.